I should have been able to go into hospital, and the same way there was an orthopaedic surgeon to fix my elbow and the same way there were plastic surgeons to, stitch my face up, there should have been a dentist.
I've dealt with people who have no teeth, can't afford dentures, malnutrition becomes a problem.
I was riding down St George's Road and I managed to trip my spoke in the front wheel and was still holding onto my bike, so I ended up hitting the concrete face first and evidently my elbow, because I broke that as well. And a friend was with me and he called. I said to him, call an ambulance. I guess they worked out at what point they would be able to do surgery on my elbow, but sort of my mouth, I had ended up knocking out a full tooth and sort of smashing two other teeth, and that part of it was largely ignored. What I didn't understand why I could go to hospital and have an orthopaedic surgeon fix my elbow, plastic surgeons, stitch up my face, but that my mouth, just stayed bloody and with fragmented teeth for days, and then I just had to go away and consult dentists and periodontists and maxillofacial surgeons and work out what I should do to get that fixed as best as possible at my own cost.
This is someone who fell off their bike, they hurt their elbow, those injuries were dealt with, but in terms of having lost a number of teeth in that accident, that was the thing that wasn't dealt with, and it cost her $14,000. Now, most people can't possibly afford to pay that kind of money, and if you had a dentist scheme, if it was your teeth or your elbow or your leg, they'd all be treated equally.
So I've got two folders, one for all my hospital appointments and invoices, and one specially for my teeth. So it's this whole problem around the teeth are totally separate and you have to manage that whole side of it yourself and pay for it all yourself, whereas all the stuff in the hospital, you have this follow-up regime of clinics and appointments and surgery and advice that's all covered under Medicare.
The Greens believe that going to the dentist should be just like going to the doctor. We think that people should be able to use their Medicare card when they go and see a dentist. At the moment, at least 1 in 3 people delay going to see a dentist because they can't afford it.
Well, the Denticare scheme is actually going to deliver money to each state for infrastructure, and the way it's going to affect us in the western suburbs is that we have a particular clinic, the Western Region Health Service, and it's got a children's clinic that is so ancient, the equipment is in a terrible state. If it's a hot day, they can't actually put fillings in children's mouth because the filling sets before they actually can get it into their cavity. With a federal Denticare scheme, it means that we're going to be able to say to the government, the Greens got this money for Denticare, you need to match it dollar for dollar to make sure that the Western Region Dental Clinic gets rebuilt.
The Greens have made Denticare one of their top priorities in this parliament. I've been working very hard on this, and I'm really pleased to say that the Greens have achieved a huge win for the community by getting a $500 million investment in public dentistry. But that's just the first step. We want to make sure that we fund private dentists so that going to a dentist is just like going to a doctor. If you go to a private dentist at the moment, you need to pay up front. Our view is that we should have Medicare funded dentistry in this country, and it should start straight away.